Okay.
Okay, good afternoon, everyone. Family and friends, thank you for being here.
Can we have the full screen? Yeah, that's good.
I'm going to mute everybody. And then we will have a, this is being recorded. So after the presentation, you will get a copy, and please feel free to share. And at the end, we will open the floor for Q&A. Over to you.
Sorry?
Over to you.
Over to me. Okay, so good evening, everybody. Magandang gabi sa inyo lahat. For those of you who don't know me, my name is Richard Walker. I'm Mapit's husband. I work as a science communicator and a scientist in a big neuroscience project in Switzerland called the Blue Brain Project. And for various reasons, I also worked in the field of epidemiology, though I can't claim to be a true epidemiologist. And I'm going to be talking today about what we can say. I'm very much in contact with the latest research. I'm going to be talking today about what we can say about the coronavirus epidemic today, where it's going, and particularly where it's going in the Philippines. Now, I know it's a very serious situation, and lots of you are glued to the TV or to the internet for hour-by-hour news. I would suggest this is not particularly useful. It's not very good for your mental well-being either. The news, real news, does not change on an hour-to-hour basis. It changes on a day-to-day basis, a week-by-week basis. So most of the things which really matter change fairly slowly. And it's quite enough to listen to the news once a day or even once every 2 days. You'll learn everything you have to know. And you really want to look out for some of the slower trends, some of the things which are changing slowly, but fortunately in a rather good direction. And those are the things which I'm going to be talking about today. Next slide, please. So, you know that on March 15, your president ordered a big lockdown. This evening, I'm going to be talking about why that was essential, why it's so important, why you do have to take it seriously. I'm going to be talking a little bit about the data you're seeing in the news, and I'm going to give some words of caution about how you should interpret that data to avoid it seeming too alarming, but also so as not to minimize it. Then I'm going to move on. I'm going to talk about the current situation in the Philippines and what we can learn from that. And I'm going to be giving some good news. The trends we're seeing in the data actually look fairly good for the Philippines. I'm going to talk about lockdown measures, not just in the Philippines. I'm going to compare to what's happening in other countries. We're going to see they're all pretty different, but we're also going to see that most of them, the US is a big exception, most of them seem to be working. So it doesn't really matter if your lockdown is just a little bit less efficient than somebody else's. I think the effect is going to happen anyhow. And then I'm going to end up by talking about what happens next. So can I have the next slide, please? Next slide, Muppet. So the first question I wanted to ask was, why is your president doing this? Is it worth it? Is this just being crazy? And the answer is, no, it isn't. Now, in an epidemic, the number of cases increase exponentially. That means they can increase by 30% a day. Now, you just imagine having a debt with interest of 30% a day. If you start like that at the beginning of the year, at the end, your personal debt will be higher than the national debt of the Philippines, maybe higher than the national debt of the United States. So if we just let exponential growth go its way, just let it carry on, In the end, something like 60 or 70% of the people in the Philippines would get coronavirus, and something like maybe 1% of those would die. That means maybe it's less than that, maybe it's a bit more, something between 300,000 and 600,000 people would probably die. And worse still, there'd be a massacre of old people like me and like your loli, like your lola and your lolo, like your parents. So we really desperately don't want that to happen. Now, in Italy, it started off going exactly that way. The Italian epidemic, for several weeks, they did absolutely nothing. And today they have a huge epidemic. We have more than 80,000 cases today, nearly 10,000 deaths. It's really horrible. That's what seems to be happening in the US too. But the good news is it's not happening in the Philippines. What you see on this graph is what would have happened with no action. But there has been action. The action was pretty tough. And I think the action is going to have an effect. I'm going to show why I think that later on. So basically, we're moving towards a situation where we actually kill this epidemic. We call it epidemic suppression. I'm going to say why I believe that later on. But first of all, I just want to talk about some of the data you're seeing in the press and how you should read it. So next slide, please. And the next one. So you get a lot of cases reported every day about how many cases there are. Now, you should take that data with a huge pinch of salt. This isn't because people are being dishonest with you. I don't think there's any serious dishonesty involved, but you become a case from the point of view of a newspaper report. If you do a test for coronavirus, and if the test is positive. Now, you will today in the Philippines, that very few people are being tested, and even elsewhere in the world, most people who get sick are just told to stay at home, so they never get a test, and they're never counted as a case. So it's extremely likely, and this is bad news, that there are 100 and 150 times more cases than are being reported. So that's obviously not a good thing. Second point, next click. We also don't know how many people have died. You will be reported as having died of coronavirus if you are tested positive and you then die. But as we see, lots of people are not tested and quite a lot of those people die. So those deaths are never recorded. At the same time, you may have several diseases at once. A lot of the people who die have what's called comorbidities. They may have heart disease or cancer or some lung disease. And very often doctors will write down that they died of the cancer. That's fair enough, but it doesn't give us a true picture of what's happening with the COVID. So people who die of 2 or 3 diseases at once, they might not write down COVID. And I think all doctors and all administrative officials are very wary of saying that someone's died of COVID. They don't want to, their natural instinct is to avoid provoking panic. So I wouldn't call this a lie, but if they've got 2 possible diagnoses, they might very well choose the least alarming one. So we've seen number of cases is dramatically understated. Probably the number of deaths is understated too, and that's true in the Philippines. It's also true just about everywhere else in the world. This is not a Philippines-specific thing. It's something which is happening absolutely everywhere. Now, next, click again, please. But these biases remain more or less the same over time. So the percentage of cases which are not reported, this probably doesn't change that much. The percentage of deaths which are not reported doesn't change that much. So even if we don't know how many people are sick, even if we don't know how many people are dying, we do know how these numbers are changing. If the number of people who are getting sick goes up in the official numbers, that's certainly true. They are going up. And if it goes down, hasn't happened yet, but if it goes down, that is probably true too. So if we can't trust the absolute numbers, but when we look at if the numbers are going up or down, we have a fairly good idea of what's actually happening. So let's look at some real numbers. Next slide, please. So I want to make one of the countries where the epidemic is worst is Italy. Italy has a population of 58 million. They have more than 86,000 reported cases, and remember, the real number may be much higher than that. And they have 9,000 reported deaths. The real number is probably a bit higher than that too. Now look at the Philippines numbers, which were up to date at 11 o'clock this morning. You have just over 1,000 cases and 68 deaths. Now, even if you multiply that by quite a lot, it still doesn't reach the Italian numbers. So it looks as though the Philippine situation is not too bad. Now, you shouldn't rely on that. Italy's epidemic started more than a month before yours. And because we have this exponential growth, things go up enormously. You can have 1,000 cases one day, 1,300 the next day, 2,000 the next day, and so on. It can go up enormously fast. So because the Philippines epidemic started much later than in Italy, the cases and the deaths are not so many so far, but they will go up a lot. But before we go any further, there is some good news. Because most cases are not reported, the death rates look very high. The real death rates are almost certainly a lot lower. So we think that probably 1% of people die, maybe even 0.6% of people die. That's still a huge number of people. It's still horrible, but it's not sort of the 4 or 5% some people are talking about. And someone asked me, but are we all going to get this? Are we all going to die? The answer is very definitely no. Probably 99% of people recover. Though that's still not enough, but it means it's not quite as bad as you might be tempted to think looking at some of the numbers. But these are just absolute numbers. And I said we can't trust them. So I'd like to look, instead of the absolute numbers, I'd like to look at the trends. And can we have a look at the next slide? So I made these graphs this morning. This is the trend in cases in the Philippines. That's the blue line. And it's the trend in deaths in the Philippines. That's the red line. Now from the blue line, you see that the number of cases is really going up. This is what you'd expect if you had exponential growth. It's nothing strange, but it's not good. Because if you project that curve into the future, if it carried on at growing at that rate, yes, all the Filipinos would get infected. But we'll see that that's not going to happen. The red line at the bottom is the number of deaths. The number of deaths is growing much slower. But again, we have to be very cautious with this number. It takes quite a long, there's about 20 or 30 days between when a patient actually gets infected with COVID virus and when he recovers or when he dies. So the fact that deaths aren't growing very much at the moment is good, but it doesn't prove they won't grow in the future. I would expect that in the next few days they'll actually go up quite sharply as the people who got sick 2, 3, 4 weeks ago, a few of them begin to die. So what you see is okay, but it doesn't mean we're safe. Fortunately, however, there really is some good news. So now, next graph, please. So here I've made a graph comparing the situation in the Philippines, that's the blue line. This is number of cases. The number of cases in Italy, that's the red line. The number of cases in China, that's the yellow line. And I've done it for the first 19 days of the epidemic. Now, what you see is that the growth in the Philippines is much, much slower than the growth either in China or in Italy. And this is true even before your government took any measures. So this doesn't reflect the lockdown. So something was keeping the Philippine situation more under control even before your government made the lockdown measures. And that's very, very good news. Next slide, please. And if we look at the number of deaths, we see the same thing. Again, yellow is China, red is Italy. You see they're growing almost exactly the same rate. These are, again, the first 19 days of the epidemic. And if you look at the Philippines, you see they're growing much, much slower. Now, why could this be? As scientists, we have to say the truth that we don't really know. But there are some ideas. Now, one idea is that the Philippines has a very young population. You've got huge numbers of young people. And we know that young people certainly die much less of coronavirus than older people. So that's good news. But that's just a proportion, you know, maybe 5% of the old people, a lot of them die, maybe 10%, and young people, maybe it's 0.1%. But you'd still expect the number to rise the same way. So that explanation doesn't actually explain what we're seeing. Now, there are some ideas going around, but again, don't take these as being scientific truth. It would be very good for the Philippines if they were true, but we don't know that yet. There are some ideas that hot weather, like in the Philippines, it's very hot at the moment. Hot weather means that the virus doesn't survive very well on surfaces. And therefore, it's harder for people to get infected in hot, dry countries than it is in cold, wet ones like northern China in the winter. Now, this is not a fact. Don't quote it as a fact. It's a hypothesis. And if it was true, the hot season is going to last for some time in the Philippines. It would be very good news for the Philippines too. But that's not the only good news. There's more good news. Next slide, please. Now, this is a graph of cases and of deaths in Hubei province, China, which was the first area of China to be affected by the epidemic. And it's first one to get out of the epidemic too. Now, they actually intervene. Unfortunately, the data we have only starts on January 21st, and they actually intervened on January 23rd, just 2 days later. They had a real lockdown. They had a tough lockdown. So that's, when I say day zero, that's more or less the day they had the lockdown. Now, if you look at the graph, you'll see about day 21, the number of deaths. These are total deaths. It's not the number of deaths per day. The total number of deaths suddenly starts growing much more slowly. So that's 22 days after lockdown. Remember that number. And 46 days after lockdown, the number of new cases practically stops. They're still having 2 or 3 a day, but it's now an extremely small number. And the number of deaths by about the same time also practically stops growing. Next slide, please. Now you could say, yes, but the Chinese are so good at doing things. They're so organized, they're so disciplined, they're so tough, they're so authoritarian. The Philippines is not like that. We know that government can be chaotic at a central and at a barangay level. We know that Filipinos don't always obey rules. We know that there are problems in implementation. People don't, even when people are in good faith, they often don't understand the rules. But that having been said, there is little doubt at all that the intervention of your government was a very strong intervention. which really reduced social contacts between people and really reduced the opportunities for infection. So it would be very strange if this didn't have an effect. And you all know how big it is. To know how big that intervention was, just feel how your daily lives have changed over the last 2 weeks. Just look at the traffic. If you ever go out of the house, look at the traffic. You see there isn't any. So it's an enormous change in the normal way people live. And this really changes the prospects for the epidemic. Now, the Philippines hasn't intervened in the same way as China, but neither has anybody else. In every country, the interventions are different. Here in Switzerland, where I live, it's a little bit less tough than in the Philippines or in Italy or in China. In Italy, it's very tough indeed. In Holland, it's a bit more like Switzerland. They're a little bit more mild. But what is true is that in most countries, there's really been huge measures to keep people at home, to not send them to work, to not have them on public transport, to not having them going to bars and restaurants. And this should really, in theory, this should reduce how many contacts there are and therefore how many infections there are. Now, yesterday evening, a new study came out and they're looking at the way infections are rising everywhere in the world. And it does seem, the conclusions of this study, which is still preliminary, but everywhere in the world, the interventions are working. And just as you saw in China, China is ahead of the curve because they started first. Just as you saw in China, the rise in the number of cases is first slowing down and then stopping. The rise in the number of deaths is slowing down and then stopping. There are 3 countries where this is not true. It's not true in the US. It's not true in the UK. It's not true in Brazil, where you have governments that deny the reality of coronavirus. Then today you have a very, very serious problem. But your government, which has many faults, did not deny the reality of the virus, and it did take action. So your epidemic came later than the Chinese one. It came 2 months later, roughly. So of course, your intervention also came later. That's not a mistake. The intervention was on March 15, which is less than 2 weeks ago. So let's look what would happen if the Philippines follows the Chinese pattern. Next slide. So, of course, we don't know that the Philippines will follow the Chinese trajectory, but the study I read last night says that basically all countries are following the same trajectory. So we expect to see approximately the same effects. So if the Philippines follows the Chinese trajectory, by the end of next week, you'll get a slowdown in cases. There'll still be plenty of new cases, but the growth will start to slow down. The curve will bend just down, just as you saw it bending in China. And in 2 weeks' time, you'll see a slowdown in deaths, the same slowdown in deaths. And if we're lucky, by the end of April, you'll get very few new cases. And basically, the epidemic won't be completely over, but it will be under control. It's like when you have a bushfire, which was just burning out of control, and then you get it under control. All this, of course, assuming that the lockdown is maintained. If it breaks down, if everyone starts going out on the streets again, and if everyone goes back on public transport, goes back to the restaurants, then this will not happen. So this assumes that at least for another month, things carry on as they are today. But in that case, there's a real hope you'll get down to a situation where things begin to come back to normal. Now, even in China today, in Hubei province, there still are a few new cases. And most of the people didn't get the infection. That means they're not immune. And that means each of these new cases is a danger. the new case, just like they did in the past, the new cases can cause other new cases, and the whole thing can go out of control, and we're just on a yo-yo. It's just going back to where we were before. So obviously, everyone knows we have to stop this from happening. How to do that? Governments are only just beginning to think about that now. It looks as though the solution is going to involve some restrictions which are maintained. I think a lot of people will be able to go back to work. You'll be able to go out of your houses more, but there will be some restrictions. A fundamental thing is very widespread testing. We basically need to test everyone in the population about every 2 weeks. So that means that there will be some cases. It means you find them. It means you isolate them. It means you find their contacts and you isolate them. It means that one new case is not a danger to everybody else. Now that's incredibly hard. But today the tests are costing of the order of $100 per test. That's a huge amount. They require a doctor to give the tests. That's too complicated. We have places with many places in the Philippines with no doctors and no tests. But we have to make, if we're going to go back to normal, that is the way we can do it. And the good news is, today I talked to some of the people in WHO, World Health Organization, yesterday, who are working with tests. There are now 200 companies in the world proposing different tests. And some of these are going to be very cheap, easy to administer, and very, very accurate. So hopefully the Philippines government will be able to either receive tests as a gift from somebody or buy them at a reasonable price. And having this sort of widespread testing becomes possible. Now, all this is very, very difficult, but it is possible. I think the message is things are going to improve and fairly fast, but we're not going back to business as usual. At the same time, there's a lot we're going to have to deal with the economic impact of all this. We're going to need to find help for all the people who are losing their jobs. We have to find help for all the people in the informal sector who are not managing to make any money, but who still need to eat. But I think even with all this, there is real hope that before the summer, we'll have a life which is much easier than the life we have today, even if it isn't completely back to normal. So, next slide, please. Last week in Wuhan, which is the city in Hubei province where the epidemic started, public transport started up again, work is starting up again, even entertainment is starting up again. There are still cases. Chinese are being incredibly careful with that. They could crack down again if the epidemic seems to be bouncing back, but it shows that a return to normal life is possible. So this is all what happened in China can happen in the Philippines 2 months later. So I think within the next 2 to 3 months, next slide, we'll get back to normal life. That's EDSA. For anyone who doesn't recognize it, it will take me 3 hours to go to Quezon City from Las Piñas. And so we'll all be happy. And then we can start talking about many of the other problems which the Philippines has. Thanks a lot for this. That's all I have to say for today. I'm going to be coming back maybe in a week's time. I don't have a fixed date yet, but we have a question and answer section. If you have any questions, could you type them into the chat box and Mapit will read them out and I will, or maybe Harvey, I don't know. One of the two of you, Harvey will read them out.
Yes.
And to the best of my ability, I'll try and answer them. Thank you very much.
All right, thank you, Richard. For everyone who has questions or comments, please type them in the group chat. First question, this is from me. There's a growing sentiment that the low numbers right now are due to the slow process of testing in the country. Some argue that mass testing will definitely make a huge difference. How true is this?
I think it's absolutely true. The absolute numbers are almost certainly false. I'd estimate probably you have 100 times more cases than are recorded. But this is not just a Philippines problem, as I said. It's true. There's no country except maybe South Korea, which is really trying to test everybody. So this is true everywhere. You have a lot of cases, but most of these cases which are not tested will be fairly mild cases, so it won't matter to people too much. The problem is that these people can still infect others. The death figures are probably a bit more accurate than the case figures, but even there, the deaths are also understated. So I agree with whoever said that. They will go up. But the important thing is, even if the number of cases recorded goes up, the trend, the fact they're going up or they're going down, is probably a good approximation to the truth. And at the moment, they are going up much more slowly than elsewhere. So even with all these qualifications and the fact we know they're certainly underestimated, I still think there's an optimistic message there.
All right, next question. What are the chances that this virus will mutate?
All viruses mutate all the time. Most mutations will kill the virus and it will just die. A few will help it to spread. It's possible it's possible it could mutate and become less deadly. It's possible it could mutate and become more deadly. And there's no way of saying that. Both possibilities are real. But it does seem that the virus is moderately stable. So at the moment, we don't see any signs of big bad mutations happening. Then there's a longer term problem. This is one of a family of coronaviruses which exist in other animals. They exist in quite a wide range of animals: bats, camels, marmosets, and several more. They can also probably cross into pigs, chickens, this sort of thing. And it does seem that this family of viruses is dangerous. This is the third epidemic we've had. Before we had COVID, we had SARS, and we had MERS, which was a disease which humans got from camels. So it does seem now that those new diseases are caused by a mutation in the virus in the animal, which then passes on to humans. And they are a risk. So even when we've beaten COVID, this danger is going to remain. And actually, scientists have been warning about it for 10 years, but no one notices until a disaster happens. Next question.
All right, next question. Has there been any study comparing climate and virus spread to reinforce our hope that the Philippine weather is working to our favor?
There are studies. There was one particularly in China which showed that in colder northern China, the virus spread more than in warmer, more humid southern China. But it's one study. We don't have enough studies to say that's a firm conclusion. And they're not studies from they're not studies of the highest possible quality. So it could be true, but it's very definitely not proven yet. But your Philippine numbers seem to suggest that it works for the Philippines. Yes.
Okay, sorry. Next, how far away are we from a cure and a vaccine?
Okay. Start with cure or treatment. A cure, something which just cures it and you're better. There's none on the horizon. But there's quite a lot of drug trials going on, various different things. There's some anti-malarial medicines people are trying out, like chloroquine. There are some antivirals people are trying out. People are trying out taking plasma from people who've been infected and recovered and injecting it into patients. That may have an effect. The trouble is it's a bit too early to see which of these things really works. None of them yet have a really large-scale trial proving they work, but some are showing some quite hopeful signs. Now, I think what's definitely true is that as the epidemic goes on, doctors are improving the way they treat patients. There's a huge sharing of information between doctors around the world, and they all learn from each other. So there's going to be a lot of small incremental improvements in the way patients are treated, and that's going to save lives. So on the cure, I think a dramatic cure seems a long way away. We don't have a dramatic cure for the flu yet, and we've been living with the flu for a very, very long time. But slow improvements we will have. Now, really the most important thing would be a vaccine, just so that no one gets it. We deploy that and basically no one gets the disease anymore. That would be wonderful. Normally, vaccine development takes between 12 and 18 months, assuming you don't meet any horrible obstacles, like in the case of HIV, we're still waiting for a vaccine. So, and that's 30 years into the epidemic. There's hope in this case, we can get one in reasonably fast, but I think we're still talking a year or 18 months, probably, unless someone makes some amazing discovery tomorrow morning. But even when you make the discovery, vaccines, like all medicines, need to be tested. You're going to inject billions of people, so you need to be really sure that they're safe. And this is going to take a little bit of time. Next question.
Okay. Next question. Based on the Chinese trajectory, we need to continue our full lockdown for another month, meaning Philippine government should extend the lockdown until end of April. Is this correct?
End of April as a minimum, and maybe end of May.
Okay.
But certainly, I think the chance of getting out of the lockdown before end of April is almost null, is almost zero.
Okay.
It will depend
Next
how.
question.
It will depend how. So, but there's a phrase. There's two phases in an epidemic. One is when you have sporadic cases. When you've got a tiny number of cases, it's possible to find them all, isolate the people, and everyone else can carry on with their normal lives. That's where we were at the very, very early days of this epidemic. We're not there at the moment. Then you have what's called community spread. That's where the virus spreads throughout the community. And there's so many cases, it's absolutely unthinkable to catch them all. And it's even less thinkable to go and trace all their contacts. So the goal is to get the number of cases low enough so we can really catch most of them, trace their contacts and confine them, and let other people have a semi-normal life. That's the goal. And the third thing you asked about, before, you asked about vaccines, you asked about treatment. There's a third thing, which is super important, which is testing. We must be able to test very, very large numbers of people. And we have to repeat the tests frequently, because unfortunately, the fact you test negative today doesn't mean you don't catch the disease in 2 weeks' time. So we need to test people and retest them. And I think in a policy point of view from the Philippines government, if you're listening, Mr. President, this is a really top priority. You need to roll out tests, and it's like wartime. It's life and death. If you want to go back to normal life, you have to be able to test people in very large numbers.
All right, next question. Is anyone looking beyond the curve to avoid recontaminating quote-unquote stable populations or geographies? The globe seems to be consumed by the shock of the early phases of this journey, where we need to break the cyclic potential.
Yeah, so there's basically no such thing as an uncontaminated population anymore. It's reaching nearly everybody. There may be some people in isolated groups, ethnic groups, or isolated villages or little islands in the Arctic who stay immune, but it's reaching nearly everybody. So contamination of those people is no longer, sadly, it's no longer a concern. The question is really what happens when the epidemic is over. Most of us at the end of this epidemic will not be immune. So we will still be vulnerable to the epidemic, to the virus. And some countries are going to, because some countries started the epidemic earlier, China is the biggest one, they will also finish earlier. So the Chinese government is taking extremely stringent measures to make sure new cases don't come into China. And I think that's going to be the case just about everywhere. Everyone, once you've recovered, you have to make sure the house doesn't catch fire again. So one of the last things to recover, I think, in this emergency is going to be international travel. I wouldn't want for the owner of an airline at the moment. Next question.
Next question. Can the low number of deaths in the Philippines be attributed to a relatively healthier and younger population?
Healthier, I just don't believe it. Younger, yes. You are, well, of course, because you're younger, you're also healthier. Yes, but that doesn't explain the trend. Like, actually, the number of deaths is growing very slowly. And this is rather hard for me to understand. It's not what we expected. So it's a thing with a lot of question marks. But delay in reporting doesn't explain that. If all the reports were delayed, you'd still be growing at the same rate, but everything would be a bit slow. You'd have the reports from 2 weeks ago. I'm sure we do have the delays, but that doesn't explain why the growth is slow. Next.
Next question. Can you give your thoughts on why various governments do not appear to be collaborating and sharing knowledge and resources to fight the virus as a human race, rather than the domestic or country issue? Shouldn't WHO or the UN facilitate this to combine capabilities and maximize effectiveness for all?
So I'll start at the end of that question. The WHO and the UN is making a massive effort precisely to do that. In parallel, there are huge efforts going on between doctors worldwide. There's huge efforts going on between universities worldwide, and I'm involved in that. So there is a huge amount of collaboration going on. And I think most decision makers, most doctors everywhere in the world do have access to most of the information you need. Now, there's some people who appear not to understand it. Matigas ang ulo nila. And, well, we know who those people are. Some of them have orange hair. We'll see. I think circumstances will force them to understand it very fast.
Yes, that is the last question for now. For anyone else who has questions, please type them in.
I will open the floor because there are no more questions coming in via the chat. I'm going to open the floor for questions. I will unmute everybody. So if you have a question, just please say so. So all of you are now unmuted.
So we can talk.
Yes, Professor Pasco, you can talk. You want to take the first question?
No, I just wanted to welcome Pauline. I'd like to verify that she's around.
Yes,
Pauline is around, yes.
Pauline is here.
Pauline!
Here. Hi.
Pauline is from Fukui.
Okay.
Pauline, would you like to ask any question to Richard?
Oh no, I'm so sorry because I didn't hear the whole thing. But then, okay, give me some time sort to think, and then I'll get back to you.
Yes.
Okay,
can I say if anybody missed some of this, we're going to have a recording of it. We'll be posting it on Facebook very soon now. And so anyone who wants to go back and see things or see the slides, they'll be able to do so. If anyone needs the slides, for instance, as a basis for other lectures or talks you have to give, just drop me a line. I'll send you the slides. They're not copyrighted. Nothing in there is copyrighted. Don't waste time asking for my permission to use, just use.
Okay. Richard, I wanted to ask you if you're aware that most of the fatalities are in Metro Manila. Okay.
This is fairly normal. Sorry, I'll let you carry on in a second. This is fairly normal. The number okay, you carry on and then I'll finish.
Okay, then I wanted to ask you if it's possible now that Metro Manila is going to be the last who would have the lockdown lifted. Okay, if we compare it to, for instance, my province in Sorsogon, no?
Yeah.
Up to now, there hasn't been any report, no, about any COVID victim there or patient there.
So before I answer that, can I ask a question? What's happening in Cebu and what's happening in Davao?
They're fairly insulated, no? Compared to Metro Manila, it's really Metro Manila who's bearing the brunt, no, of the COVID epidemic. But if you look at the provinces in the islands, for instance, no, you wouldn't. And many of the quote unquote violations of social distancing are happening in those areas where reports of COVID patients are virtually non-existent.
So,
I want. I
so yeah,
want.
I'll start with that. So the first thing is the fact you don't have a lot of reported cases doesn't mean there aren't cryptic cases. There aren't cases which are hidden. So you should assume there are cases everywhere, particularly in places where very few people are being tested. So
Uh-huh.
so there may be cases in here, but it's quite possible there are genuinely less. That means that if you live in one of these isolated places, it's still important to obey the rules and to maintain your social distancing. You know, the fact you've not got an uncontrolled epidemic yet is a super good thing, but the only way to make sure you don't have one in the coming weeks is to really follow the rules. So it's just as important in places with very few cases or no cases as it is in places where there's a lot. Now, coming to Metro Manila, it's absolutely normal. Most of the cases should be there because an epidemic spreads through social contact. The more people you're in contact with, the more people, infected people meet, the more it spreads. And we all know that Metro Manila is a very lively, very social city where people travel throughout the city on P2Ps, on jeepneys, on tricycles, sometimes with a driver, to go from their home to their work, from their home to their entertainments. So this provides billions of opportunities for the infection to spread. So there's nothing even remotely surprising about this. If you live in a Bahay Kubo in the middle of nowhere and meet other people once a week, your chance of infection is much, much lower. So you asked, will Metro Manila be the last people to get out of the lockdown? I suspect that probably it will be the same as with everywhere. Ideally, the lockdown should last until the Philippines is more or less free of cases. And until you can get the cases down to very small numbers, then you can begin to ease off.
Okay. Can I follow that up with, you
Yeah.
know, the Philippines is an archipelagic country.
7,000
Okay.
islands, yeah.
Yeah. And would it be possible to adopt uh, an island to island policy about how those social distancing measures would look like?
You mean different policies in different islands?
Yeah,
Or you
something
mean
like that.
or you mean limiting the transport between islands?
Yes, including that.
So I don't know I don't know how much transport you have, which is indispensable. Like, yes, people need food. Yes, they need medicine. They need water. They need fuel. There's all sorts of things people need, and we can't eliminate that. Otherwise, people they don't die of COVID. They die of other things. So you can't completely eliminate that. But yes, the fact that you're divided into a lot of isolated places, isolated by the sea, and we're very sure that the virus doesn't live in seawater, that is a very good thing. It helps you. You know, it's as though you're in war, and the enemy, instead of having a big army, the enemy is divided up into lots of little villages. You can attack the villages one by one.
Yeah, but one of the reasons why the Muslim rebellion couldn't be checked because of the porous boundaries,
Yeah.
especially in the south. Okay.
Yep.
And also in many of the islands, many of the Filipinos own their own small rafts and bangkas and boats.
Yeah, sure.
No? They even have more boats than the Philippine Navy. Okay. So and that will that will really pose
that may be the sign of a sane country.
of a sane country. Yes.
Yeah.
Okay. So I'm thinking more along the lines of something more mass oriented as solutions to this pandemic.
Yeah.
Because it appears to me it's always top bottom. No, and I mean the people should also be mobilized as they are now being mobilized. No, but the thing is we really have to rely on the local leaders, no, to effect the necessary changes to give a knockout blow to COVID-19.
So actually, a few weeks ago, Harvey, who's with us, who's actually studying in Geneva here and studying governance and developing countries, posted a very interesting thing on Facebook. Maybe he would like to repost, in which he was saying, okay, the central government response in the Philippines is a bit chaotic, but maybe this is a good thing because real effective governance does come from the bottom up. You know, you get your barangay captains to do things, and a lot of them, the reports we're reading, is that a lot of them are doing very, very effective things. It's sort of more like it's less like moving a big army in the field. It's more like guerrilla war. It's more like guerrilla warfare.
Yeah. Exactly. Can we have that post by Harvey?
Harvey, can you
Okay.
repost that? I thought it was a great article you wrote. Or
Yes, I will look for it. I'm looking for it now, actually.
Okay.
Okay, may I ask the last two questions, given it's 9 o'clock already in Manila and 10 o'clock in Japan. Just conscious that people also need to rest. So just as closing, two questions. So what could we as individuals do to help other than staying at home? And the question number two is, other than lockdown and testing, what could the Philippine government do differently, copying from best practices happening right now?
Okay.
I'm sorry. Is it okay if I just add a follow-up question to your first question?
Go ahead.
Yeah, sure. Is that Jackie? Is that?
That's Pauline.
That's Pauline.
That's Pauline.
Yes,
Okay.
it's Pauline. Sorry, I'm Pauline I'm a Filipina from Japan. Anyway, probably just to add on that one, how can individuals actually at home, for example, do some disinfecting in their own houses? Because right now it's always wash their hands, do social distancing. But before this, even in the barong, people actually has been meeting each other. So what can they do to disinfect their own houses also, given also limited resources? Thank you.
Okay, so I'll take the first one first, the one about what can you do as an individual. Then I'll come to what the Philippines government can do. As individuals, you can stay at home. The other thing is, there's a huge, the suffering caused by this epidemic is not only medical. In fact, the medical part is a very small part of it. It's people who see their income go away. If you're selling balut from house to house, you're not going to get a lot of buyers at the moment. If you're a tricycle driver, you have no more work. If you're a bus driver, you have no more work. If you're a salesperson in one of the malls, you have no more work. So lots of people lost their jobs. One thing you can do is, wherever you have an income and you have the ability to spread a little bit of well-being around by using the services people offer you, or by giving a bigger tip, or paying delivery people something extra. All this is very, very helpful. And if you look on Facebook, in fact, there's a lot of suggestions from people in the Philippines, what you can practically do to help economically. So that's a big thing. What can you do hygienically? Well, you don't, big message, you don't actually need the alcohol so much. If you've got it, it's good. It works really well. So use it if you have it, but if you don't have it, water and soap are really good. But also, you don't need to become obsessive. The problem is not really, if you have a house and no one's been out for 10 days, the chance you have an infection is very small. So, the hygiene within the house, just be hygienic as you always are. You don't need much more. The big problems come if someone is actually sick in the house. Now, I think there is professional advice for this about what to do, so I'm not going to second guess that. I think if you look on the web, what to do if someone has coronavirus or suspected coronavirus. If someone is in quarantine in your house, for instance, you leave the food outside their door, you don't go in and talk to them, then is the one case where wearing a mask is really useful. WHO advice at the moment is that masks probably don't change that much unless you're either sick or directly dealing with sick people. But in those cases, it definitely does help. There's lots of other advice too, so I'd prefer to leave this to professionals. You can find all this advice by going to Google. Just look for the most reputable source possible. Don't just take anybody's Lola's advice as put out on. The Lola was usually pretty good, but by the time it gets to Facebook, it gets distorted and spoiled and doesn't work very well. Going on to Professor Nolasco's question about what can the government do? I think one thing is not lose courage and carry on doing what it's doing already. I think it's working pretty well. So one is just more of the same. Don't give up too soon. The other one is you really have to think and plan about what's going to come next, because within the next 2 months, things will be an awful lot better. But how do we stop the epidemic from rebounding? Now, there's lots of people talking about that worldwide. No one has a definite answer, so people are going to experiment. You want to be looking out for what other people are doing. Some of these experiments will work well. Some will work badly. You need to learn from that. You need to be ready to change your mind if what you do doesn't work. And the one thing which is certain is you're going to need to test. This is more important than build. And it also costs less. Tests are now on the market from various countries, particularly South Korea, particularly China. Some are being offered as donations. You can get test kits. You need to buy as many. You can't have too many. Think if you want to test every Filipino once every 2 weeks, that means you need 200 million every 2 weeks. This is huge amounts. You can probably get loans from the World Bank to pay for that. You may be able to get people to donate it to you, but we need this. We need this in very, very unimaginably large numbers. And we also need other equipment. We need hospitals where people can be isolated safely. The Chinese built hospitals in 7 days. It's a challenge. Can you do things similar? You need respirators. When you get very severely ill with this disease, you won't survive without mechanical breathing assistance. At the moment, there's just not enough respirators anywhere in the world. You need more. And then, much cheaper, you need protective gear for your medical staff.
No, actually not.
The medical staff are exposed to sick people every day, every minute, and their chance of falling ill is huge. So you must get proper equipment for them. You should either buy it, or if you can make it, and you can give jobs to people to make it. So these are the sort of basic things the government can do. Governments are trying to do this throughout the world, but some are much more successful than others. And the successful ones aren't always in the obvious places. Like the United States is a total failure. Britain is pretty much a failure. And some other countries which are not famous for being so modern are doing quite well. So see what you can learn from others, and you really need to mobilize for the next period. Any other questions?
Richard?
Yep.
I'm not sure whether it was from my page where you got the article from, but it's true that LGUs, when the president assigned LGUs to work more on the health issues at the local level, from what I've read so far, it's actually a good thing. Primarily because the LGUs know better the context wherein wherein everyone is. I'm sending a Facebook post, which tries to explain why why they devolved the functions on this one. It's on the chat for everyone who's interested.
Okay.
Yeah, that's it from my end.
Okay, thank you, Harvey. Thank you for hosting. Thank you, Professor Nolasco, for asking the questions. Thank you, everyone, for staying up late and listening to the webcast. I will be sharing the video with recording instantaneously, so you please continue to share. The reason why we do this is to reach out, keep everybody informed, what we know on this end of the globe, and keep cheering everybody that there is hope. Maraming salamat po and have a safe and healing weekend, everyone. Bye-bye.
Maraming salamat. Could you, okay.